Hi, hello everybody. Hello, welcome to another health information lesson video live from me. I hope you're all doing well. This is a slightly chilly Friday afternoon here in the UK, and I'm a bit earlier than my usual live stream broadcast time just because I've got a few things going on tonight. It's a bit busy and I wanted to just get this out of the way. And it's not going to be a very long stream, but it's a topic I wanted to cover because I've had a few questions, well, more than a few, just wanting to understand about prostate enlargement. And I thought I'll just use the opportunity today and put this out there for those watching on the replay. I hope it's useful. And if you're joining me live, that's great. And you have any questions on the subject, fantastic. So I hope you're doing well. My name is Dr. Sylvia. I'm a general practitioner. I'm also a health educator. I'm a founder of AskAwayHealth.org, which is a health information website and platform with all manner of resources, blogs and videos and tips to help you keep healthy. We also have lots of different services where you can come in to ask questions about your health or arrange face-to-face reviews or discussions about your health. So today we're talking about the prostate. We're talking about, I'm very specific about the discussion today, and it's about identifying if there could be an enlarged prostate. So what are the very early signs? Now, there's so many things to talk about the prostate, like prostate cancer, but we're looking today at symptoms, because what's important about the symptoms is that if you can identify them, then you can talk to your doctor quicker, and the sooner that they can pick up any problems, then the sooner it can be treated. So that's the benefit. And I really wanted to narrow down on these 7 symptoms that men and women, so it's not just a men thing, because men are not islands. They have wives, they have partners, they have kids, friends. So, if somebody's talking to you about this symptom, let it ring a bell, let it raise an alarm in your head, so that we can look into it. So if you're joining live, hello, thank you so much for clicking on the video. I hope you find something useful. If you've got any questions on the topic, please share with me in the what do you call it now, comments box. Let me just add this to the stream. So we're talking about I hope this thing doesn't go off. Okay. It might do, but I'll put it back on. So just a bit of a graphic. Let's set the stage for discussion. We're talking about the prostate gland. A lot of prostate gland problems, the majority of the time, will apply to older men. So we're talking about from the age of sort of 50 upwards, more commonly from the age of 60, 65 upwards, when men start to see prostate problems. So if you're in that category, or your parents or your partner, or whichever, it's just good to have this information to check in with them. Remember that men can be notoriously, or some men, let me not generalize, that's not fair. Some men can be notoriously reticent to bring these kind of problems to the attention of their doctors. Give me a second. So they may struggle to bring this kind of issues to the attention of their doctors because they're embarrassed or worried of what it might mean and so on. But it's really important that if there are symptoms that you're concerned about, please come and talk to us, because many times it may not be as bad as you think, and many times it could be treated with the right therapy, with the right procedure. So it's really important that you're bringing it to the attention of your healthcare practitioner. So I wanted to set the stage so that we could first of all talk about let's talk about the prostate. What's the prostate? Where is it? It's an organ that's seated at the bottom of the urinary bladder in men. So on the right side of this image, actually, I don't know if that's the best way to show it to you. Let me show it to you another way so that you can see it without okay, I think this is probably better. So it doesn't have the thing blocking it at the bottom. So the prostate gland is an organ that's at the bottom of the urinary bladder, like you can see in this image. The urinary bladder, of course, is part of the reproductive, the urinary system. So in the other image, you have the kidneys, and you can see the tubes leading from the kidneys going into the bladder. And then you can see the prostate is the last organ at the very bottom there. That's the prostate. And this is the enlarged version of the image. So you can see how well related. And this is important. This is very important in terms of the symptoms that men experience. So I might be coming back to this graphic every so often just to emphasize the points that we're making. So that's what the prostate is. That's where the prostate is located. And it produces fluid. The fluid that the gland produces contributes towards the ejaculate or the semen to help to nourish the semen. So that's the job of the prostate gland itself. Now, as men age, as they grow older, the prostate gland begins to grow a little bit bigger. It begins to increase in size. And if it's a small increase, that's not such a big problem. If it's a small enlargement, that's not a big problem. But if it's a big enlargement, then that can cause problem. And the first problem, or the most common problem, which is what leads to many of the symptoms, is the problem of pressure. So let me show you another. Let me share this one with you. So this graphic, I think, just helps to again reinforce what we're talking about. So this is the male reproductive organs and genitals, and so you can see the penis there, but you can see at the top the bladder and where the prostate is sitting beneath. I hope you can see my icon. I don't know, but you can see how the prostate is sitting beneath. And what is important is that from the bladder, right, is running a tube called the urethra. This actually shows it better. So you see this little, from the bladder, you have that tube running, that's the urethra. And on either side of it is surrounded by the prostate gland, basically. So when the prostate begins to get bigger, then it can squeeze on the bladder and its urethra. And I said that this is what contributes to a lot of the symptoms that people have when we're talking about the prostate gland. So I really wanted to share some of the earliest signs. And I think it's important to say that these signs, like many signs in medicine, may not be specific just for prostate problem. So just the fact that you experience these signs doesn't mean that you definitely have an enlarged prostate, but it means that it could be, and it definitely means that you should have it checked out by your doctor. So don't equate any of the signs with a very serious problem until your doctor has reviewed it with you. Plus, I'm going to go through 7 signs, but they don't all have to happen in one person to mean a prostate problem. And some people may have one, some people may have another type of sign, and they are all leading to the same thing, or they may suggest the same thing. So, let's look at the video, let's look at this information with an open mind. Is to keep us informed, is to help to encourage people who may have the symptoms to come to the attention of the doctor so that it can be looked into problem. So when a man has an enlarged prostate, I keep saying we, I'm all woman. When a man has an enlarged prostate, this is also known as benign prostatic hyperplasia. In some areas, it's called benign prostatic hypertrophy. So you may have these different terms, BPH, and it's referring to an enlarged prostate. And the word benign is important there because it's not prostate cancer. It's not the same as prostate cancer. There may be some symptoms that happen similar to prostate cancer, but benign prostate enlargement or benign prostate hyperplasia is different from prostate cancer, 2 different things. So what are some of these early symptoms? Let's just go straight into it so that we don't stay too long here, because I want this to be an informative video about early warning signs of an enlarged prostate. First one is frequent urination. So by this, I mean going to the toilet to urinate frequently. So let's set the scene. Have you found yourself waking up many times during the night to use the toilet? This happens to lots and lots of men, and it is one of the early signs that the prostate is enlarged. So let me go back to that graphic of mine. So which one is it? This is that the one? Yeah, let's go back to this one. So this is the prostate gland and it's surrounding the urethra. And the reason you're getting up many times at night to wee is because the prostate is getting bigger and it will grow bigger upwards and outwards. So it will press on the bladder, reduce the volume of the bladder, and it can press on the urethra, that tube. So making the space where the urine normally would sit reduced. And that pressure is what stimulates you to get up so frequently to go to the toilet at night. So that is how frequent urination can be an outcome of, or can be a symptom of urinating, and particularly during the night. So watch out for this. If this is something that you're experiencing, please don't forget that going to urinate frequently could also be a sign of other conditions like diabetes. So remember what I said at the beginning, that the reason that we're looking at these symptoms is if you identify them, you experience them, please come to the attention of your doctor. Don't just make any assumptions. Don't just go and start drinking any medicine, because it's important to identify the cause first. So frequent urination is the first one. It happens because the prostate gland has grown bigger and is putting pressure on the urethra. That's that tube. It's putting pressure on the urethra. And so it is reducing the amount of space where the urine sits, and you're running to the toilet frequently. Every time the bladder gets full, you can't hold much, your bladder can't hold much urine. You have to go and empty it. So that's the first one. The next one is, let me share this video, which I think is really interesting. I know it looks funny, and I'm not laughing at the distress that the person might have, but I think it really emphasizes this next symptom I want to talk about, which is called urgency and difficulty starting urination. So you know that sudden urgent feeling that comes out of nowhere where you can't hold your urine. So this graphic shows you how somebody who can't hold it is struggling. He needs to go. You need to go. That's the urgency. So if you ever have that feeling, or if you've been having that feeling that all of a sudden you have to go, it may be because of an enlarged prostate. Okay, it may, I'm not saying definitely, but it may be. And then when you get to the toilet, when you get to the bowl and you stand and you're trying to do your business, it takes a little bit longer to get the flow started, or you're having to push and strain to get the urine going. So having that feeling, that sudden need to urinate, plus a difficulty, is hard to start urine when you would normally just go and it's ready to flow, this could also be an early warning sign. Okay, this could also be an early warning sign. So please be on the lookout for that one. Okay, so guys, if you're just joining, thank you so much for watching or for clicking onto the video. We're talking about 7 early warning signs of an enlarged prostate, and we're just going to go through the list and try and get them. So I just want them to be in people's heads so that they understand when to come and speak to the doctor rather than delaying. The next sign is called a weak urine flow, which everyone is familiar with. We know that when men go to wee, the arc of urine as it comes out from the penis, from the organ, is strong. It's like an arc, and it's strong. Is this the one? This is this. Hang on, let me find the other. I think it's the other picture that the other picture does it a bit better. Let's see if I can get that one out. Is it that one? No, it's not that one. Right. Okay. Look, let's just use this one. Let's just use this one. Let's just use this one. Okay, so let's just use this one, and this sort of gives you a guide about how the prostate moves, about how it, I don't know why it's paused actually, it's supposed to be moving, but that's interesting. Okay, so this is a graphic that demonstrates how, or supposed to demonstrate the pattern of the structure of the genital organs in men. And for some reason my graphic is not working. Not a problem. All right, so it's supposed to demonstrate, the male organ. Let's use the first one. At least that one is still showing. So when urine comes out from the when a man is passing urine and urine comes out from the penis, it usually comes out as an arc, in a strong arc, doesn't it? It's this is what happens in young boys and men. It's it's a strong, forceful stream. It splashes, so it comes like a jet stream, doesn't it? But if you notice that your stream, the urine stream that used to be strong and come out with force, has become weaker, or it's not as powerful as it used to be, it may be because of the pressure that's being placed on your urethra by the enlarged prostate. So let me show you what is happening. So I'm going back to this picture again. So let's get rid of that one. So let's go back to this picture again. Okay, so this is the bladder, and this is the prostate as it wraps around the urethra. The urethra is the tube that's coming out from the bladder. That's the tube that enters into the penis and through which urine flows out. So as the prostate is getting bigger and pressing on this tube, it's affecting how well, you can just imagine, it's affecting how well urine will flow out. And that's just basically the simple reason. So it can block the flow of urine, making the strength of the stream weaker. And so you might notice that there's the force with which you flow, which is your urine flows goes down, is not as strong as it was. Now, related to that is also something known as not being able to empty your bladder completely. So if you sometimes feel like you haven't completely emptied your bladder, you feel as if you've not really finished, you've gone to wee, and you've eased yourself, but you feel as if it's not done, and you have this sensation that you can't fully empty it, it could be a sign that the prostate is blocking the urethra. So you might feel that your bladder is not full, and even when you're trying, you can't get anything else out. It may be because of this prostate around this tube coming out from the bladder. Remember, I said at the beginning that a lot of the problems, a lot of the symptoms that we see have to do with the pressure, the size of the prostate gland causing pressure on the tissues around it, which are immediately the bladder and the urethra. Now, another symptom that you might notice early on is dribbling at the end of urination. So I know you might wonder what I mean, but it's even though you've finished, you've shaken yourself off and finished. If you've ever experienced, and some men say, it is annoying, because it persists and you think, come on, I'm done. But there is leaking of urine even after you thought you finished. So imagine how embarrassing that could be. It could be wetting of clothing. It could be lead to bad odor, and so it is annoying. But it's a common symptom of an enlarged prostate, because what happens is that the urine gets trapped in the urethra, that tube. Urine gets trapped there. It can't go forward, it can't go backward, it's just trapped. And so it's sort of leaking gradually out of the penis, even when you think you're finished. So you think you finished emptying your bladder and you're done, you've cleaned yourself up and you've pulled up your shorts and all that. But because there's urine trapped, because the urine, the prostate, the swollen prostate is pressing on parts of the urethra, it's made the tube narrow, the urine can't flow properly. So that's why you have this leak and dribbling that could happen. So it's quite common, and it's something to think about if you're experiencing that, or if your partner complains that he's experiencing these symptoms, something to watch out for. Okay, so another symptom that may be an early sign that something is not right with the prostate, or that it's bigger, especially if it's a man in that age group that we talked about, from the 50s, late 50s going into 60, is if there is blood in the urine or the semen. Now, this is not a specific symptom for an enlarged prostate, okay? And it's not as common as the other things I've mentioned, but it may suggest, and of course, this is, seeing blood anywhere will cause alarm at any point. And if you notice it, whether it's blood in your urine when you're going to urinate, or bleeding in your semen after sex, or whichever, it's important to speak to a health practitioner. Now, why would it happen? It could happen because the prostate is larger, it's inflaming the tissues around it. Or it is from remember I said that the prostate makes fluid that gets into this, ejaculate fluid into the semen. So it may be that it's from this irritation that is causing the bleeding. Whatever is happening, whether it's the prostate that is leaking or whether it's from the bladder, it needs to be checked out. Many other things can cause blood in the urine. A urine infection, for example, very common. Cancer, bladder cancer, for example, could cause blood in the urine. Prostatitis, which is when there's an inflammation of the prostate gland itself. That's different from prostatic enlargement, could also cause blood in the semen or in the urine. So we don't know which it is until we actually check it out. The bottom line is that if you notice that, you need to have it checked over. And so I'm going to end with this. Well, not end, but this is the last of the 7 symptoms I'm talking about today. And then I'm going to just quickly let you know about the type of treatments, because I don't want you to think that there's nothing that can be done. We really need men to open up about the symptoms. So last one, well, not the least, is the possibility of frequent bladder or urine infections. Now, just think about it. Let me get this image of mine up again. So just think about it. Where you have the bladder being pushed on by the enlarged prostate, where you have the prostate that is enlarged squeezing on the urethra, you find that we've talked about the bladder capacity or volume being reduced. urine is sluggish. When urine is trying to come out or exit the bladder, the process is a lot more sluggish than usual. It's not a free flow. So you may find that urine sits in the bladder longer than it should, and that can lead to infections, because that produces a very nice environment that germs are happy to just sort of sit in there and begin to multiply and cause infection. So that is a problem that can happen because of the enlarged prostate. It doesn't allow urine flow out of the bladder to empty the bladder completely, allows urine to, a little bit of urine just stays back every so often. So the bladder itself becomes like a reservoir that is stale. It can't completely empty itself and refresh itself. Urine is just staying there, and that is making it a nice habitat for germs to come and sit there and multiply and cause problems. So if you see any, or if you experience any of these symptoms, please speak to your doctor. Please talk to your doctor. Let's get tackling the problems. Let's do the tests that we need to assess the prostate, which include a digital rectal examination where the doctor examines you from the bottom to see the size of your prostate. That's how we do it. Yes, you can have a scan, but generally when you first go to your doctor, these are some of the things that we will do. The doctor can also arrange for you to have a prostate blood test, prostate specific antigen, to look at your PSA levels, and that can give us some clues as to what is going on as well. And then your doctor can interpret these with your symptoms and decide the next step, whether you need to be seeing a urologist, whether you need to be having other treatments. And just a little word on treatments, because there are a lot of things that can be done if you're having benign prostate enlargement. If you're having these symptoms, we've checked you out, we're happy that it's not down to prostate cancer. There are both drug treatments, surgical treatments, and even lifestyle modifications, things that you can do at home to help and control the symptoms for you. We can't begin to reverse the effect of the enlarged prostate, but some of the drugs can help to slow down the enlargement and help the urine flow to improve, and so reduce the troublesome symptoms that many men are having. So some of the things that we look at in terms of treatment are, like I've said, lifestyle changes. So your urologist or your doctors might advise you about cutting down on the amount of alcohol and caffeine, even artificial sweeteners, these weight loss sweeteners, Splendor, and all the different ones. I can't remember all the names now, but there's so many. And drinking fizzy drinks, because all those things can irritate the bladder and could actually make those symptoms of rushing to the toilet, of urgency, getting up so often at night, make it worse. So by cutting those out, the symptoms could improve. The other thing that you could be advised to do is to cut down on the amount of fluid that you're taking, or liquid that you're drinking at night, in the evening especially. And we usually say, before, if your bedtime is 10 or 11, avoid drinking anything in the 2-hour period before you go to bed. So that reduces the chance of you're getting up later in the night to wee, and that can help to keep you rested overnight and not interrupting your sleep. But you still make sure that you drink water during the day when you're up and it's not so much of an issue to go to the toilet. So the other thing I would say to you is, remember to get into the habit of emptying your bladder when you can. So at every convenient spot, empty your bladder. If you're going on a long journey, a long train ride or bus ride, or one of those things, plan ahead and make sure your bladder is empty, so that you don't get into the embarrassing situation where there's no toilet to hand and you're having to experience some of these irritations or embarrassments. Some of the things that we also advise is, particularly for people who have dribbling, that I said how it can be embarrassing, you're wetting yourself or it's causing body odor. When you finished emptying the first time, don't rush out. Wait and then try and empty again. It just gives an opportunity to try and see if you can get any more urine out. So basically it's called double voiding or double urinating. You're just trying to empty. When you've been the first time, wait a few moments before you zip up and leave the toilet. Try again, because it may help to empty your bladder properly when you try the second time. So there are other things that we could do. We could look at some of your tablets. Some tablets can actually affect the bladder and irritate the bladder and may cause some of those symptoms. So it's always worthwhile your doctor looking at them. Some notorious ones are innocent things like decongestants. You won't believe it. Decongestants or some drugs that are used for depression. So if you happen to be on other medicines, one of the things that your doctor wants to do is have a look at your tablets to see if one of their side effects is irritation to the bladder tissue and causing irritation. Healthy eating more fiber so that you're going to the toilet, you're not getting constipated, because constipation and the feces loaded in your bowel can put pressure on the bladder, causing more irritation. So there's so many things that can be done. There's bladder training. Then of course there's medication that can be used to help to relax the prostate gland tissues, making it easier to wee. So, you know, like I said, the prostate gland itself is swelling, and if the muscles are tight, that's putting pressure on the bladder, so it can help to relax the muscle. There's some drugs that can, to some extent, help to shrink. It's not going to shrink it back to its former size, but it could help to reduce the size to an extent where it's not putting so much pressure on the urethra and the bladder. So there are lots of different treatments, both lifestyle changes, just being conscious of what you're eating and drinking and how you're performing your urinary habits. Then there are medications that you could use. There are other things that you could, depending on how severe or not your symptoms are, depending on what symptoms that you're having, they might want to look at procedures like surgery, maybe removing part of the prostate gland, and some other different interventions that could be used to address this problem. So the key takeaway, we've talked about 7 early signs that could suggest somebody has prostate enlargement. The key takeaway is that a lot of these can be addressed and treated. It's important to realize that not all of them that mean that you have prostate enlargement. They could suggest other conditions. So it's important to explore them and not assume. Please don't just go and drink one herb or supplement because they say it would help if you're having weak urinary flow. I noticed that lots of less savory people, I don't want to call them practitioners, when men are having weak flow, they say, well, take this medicine. No. The first thing to do is find out why is it happening. And if it's prostate enlargement, then there could be treatments that actually have some effect that will actually do you good, rather than taking supplements that you don't know whether they're going to make any difference, spending all that money and possibly developing side effects from them. Right, guys, this is the end of this session today. Thank you so much for watching. I hope you found that useful. I know it was a sort of a guy thing today, but I have, had a few questions about this, and I have patients that are concerned, and I really think it's about educating ourselves, whether you're male or female. It's about your parents, about your partner, speaking to them about their prostate health. Please let me know if you found it useful. If you've got any questions, like I said, use our email health information service. I will place that in the link on the description box later on, and you can use that to send me a question around this subject. Thank you so much for watching. Hopefully next week's live stream, I'm hoping it might be around the same time, because this May is a busy month, lots of interesting things happening. But anyway, I will let you know ahead of time. Guys, I hope you stay well, have a lovely weekend, and I will see you again soon. All right, take care.